Good morning, good afternoon, and good evening. Thank you, everyone, for joining us on today's webinar, Enabling Remote Workplace Using Virtual Desktops as a Service using zDesk. Before I kick off the webinar, I'd like to have my two panelists introduce themselves, Chandra and Ivan, so you understand their backgrounds, and then we will dive into the webinar. Ivan, do you want to go ahead and introduce yourself?
Well, happy to. Can you hear me loud and clear?
Yes, can hear you just fine.
I'm Ivan Durbach. I'm CIO at BronxCare Health System, and we're in the Bronx, which has been the epicenter for the last 3 months here of Corona. We've had the unfortunate duty of dealing with hundreds of Corona patients, and we watched body bags take out 616, unfortunately, deaths from Corona in the last couple of months here. But we're largely over it. We still have Corona patients in the hospital, but nowhere near as many as we had 2 months ago. So, and we've had many challenges that we'll be talking about over the next hour or so about how we've dealt with that with the age of technology.
Great, thanks, Ivan. Chandra, were you able to connect? Can you introduce yourself? Okay, cannot hear you yet. All right, let me continue while Chandra tries to get because we still cannot have no voice, Chandra.
George, can you hear me now?
Yes, I can hear you now. Go ahead, Chandra. I was saying, would you be kind enough to introduce yourself?
Okay. Good morning, George, Ivan, and others, and good evening. My name is Chandramouli. I lead products and intellectual property creation for GAVS Technologies.
Great, thanks, Chandra. And I'm George Nealon. I'm a senior strategist with HiveIO, a partner of GAVS, and excited to be moderating this panel today. So with that, our focus here today is specifically talking about enabling the remote workplace. Due to the pandemic, many organizations are facing one of the most formidable challenges in history. In this new virtual economy, IT teams have to change how they adapt to this new environment. And for most organizations, a well-defined strategy is crucial and can be game-changing when it comes to how they conduct and continue to do business. Due to COVID-19, many experts believe that businesses as we know it will never be the same, and that most businesses and their IT counterparts have accepted that remote working is the new normal. So today's panel, we're going to discuss a number of different topics and have Ivan and Chandra answer a number of questions that I believe will be very much relevant to some of the challenges that you may be facing within your own organizations. Gentlemen, based on your experience, what percentage of businesses do you believe were prepared to respond to the demand of remote workers when the pandemic hit? Ivan, I don't know if you could might take that question.
And I, of course, will focus on New York City, where I'm more knowledgeable. You know, I'm curious to hear about the rest of the country, the rest of the world. We hear lots of interesting stories, but in New York City, it's approximately a third. So a third of the organizations in New York City found themselves very well prepared, as many as we went on severe lockdown and workers from home, the vast majority of workers from home, so they're able to work just fine. About a third, including us, had some difficulties, but not huge. We had to get a lot more licenses in, for example, for our Citrix receiver, which is a major software vehicle for us to use there. And then a third had very serious difficulties. So that's just a rough estimate.
Great, thank you. For those unprepared to respond, what are some of the greatest challenges? Chandra?
Yes, George. The challenges were twofold in my view. One is technical and the other one is cultural. Some groups were having their files in their local desktops, so they had challenges in accessing them from home. Some were kept in the Windows file server, but the response from Windows file server was slower. Some did not have the VPN installed in their laptops. Some did not even have the laptops. In fact, someone seriously asked whether they could connect an external keyboard to the smartphones and continue the work. And some did not have enough bandwidth at their home of effective communication. So these are all the technical challenges. And culturally, some businesses were not used to remote working. They were always used to work in person, face to face. They depend heavily on oral communication and group discussion. They were used to ad hoc and informal meetings. From home, they have to be writing down all they want to communicate in an email or chat. They have to set up meetings. Some of them were not familiar with the collaboration tools. Some were very uncomfortable in video communication. At the end, they found the discussions were ineffective. So, George, it's not just technical as many used to think, it's also cultural.
Yeah, I understand. It makes a lot of sense. Can you both describe some popular tactical approaches to address the business demands? And as a follow-up, what longer-term strategies organizations are now considering?
We had, if I can jump in, George, we had significant problems with devices, because all of a sudden telehealth became a very, very important business tactic that we had to use. Frankly, the patients didn't want to come into the hospital, and with so many COVID patients, our doctors, in many cases, didn't want to see them face to face. So what happened was we had a big rush on webcams, so we could do telehealth. Short supply around the country. We were frantically, our staff were frantically searching the highways and byways, everywhere, beginning with Amazon, just to get webcams. We also had problems with the doctors suddenly realized that when they're communicating with their patients in telehealth, they needed to see the patient on one screen and do the normal electronic medical record processing on the other. So we had a big rush to go out there and buy 600 secondary monitors. And so these are some of the problems, not to mention the software, bringing the physicians up to speed on how to use it and the like. So we had interesting challenges in that regard.
Great. Chandra, anything you'd share?
Yes. Thanks, Ivan, for that. One of the common challenges normally one would have seen with the most of the employees of the organization is the insufficient bandwidth. See, normal circumstances, the Wi-Fi bandwidth they have at home would have been sufficient for normal working. But during pandemic days, when everyone, wife and kids are confined within the homes and all access the movies and office work if the wife is employed in the same Wi-Fi bandwidth, then it becomes insufficient. The other one is the VDI challenge. Most of the organizations have asked their employees to access their work through VDI. Some virtual desktop solutions are very network sensitive, and even a small blip brings down the VDI. Some VDI solutions are network intensive and chatty. They consume huge bandwidth, and resilience was missing in some solutions. So everyone had to increase their home bandwidth. If possible, they have to dedicate the connection for office work and not mix that for the home use. And some even opted for direct VPN to their office desktops to overcome the VDI challenges. These are all the tactical ones and the immediate ones the organization had to resolve. But as a long-term approach, the organization should implement a true mobile, highly secure and network-friendly VDI solutions. It simplifies the job of enabling remote working without compromising security, availability and productivity. That's my view, George.
Great, thank you, Chandra. Thank you both. I now have a poll question that I'd like to ask the audience. Assuming remote working is the new normal, which of the following, according to you, is the most critical requirements organizations need to consider? Information security, capacity of permitted devices, network bandwidth, employee engagement, or tracking productivity? We'll give the audience a second to. By the way, if you have any questions, we do have a chat session, so please feel free to put your questions in there, and I will have a member of the panel answer the questions for you.
Maybe if you could sort of expand it to where there's less of my shirt than more of my face. You see how I am? Okay. You see how I am there?
The session is closed?
No, they're taking a poll now. About up to my chest. Could that be done to adjust? Sure.
Okay. Okay, great. So let me move on to the next question. Gentlemen, how has COVID-19 impacted the cost associated with supporting remote people, such as purchases of additional network, hardware, computers, software, etc.? Yvonne, maybe you could give some feedback, and Chandra follow.
Sure.
Yvonne, you'd like to go first, then I'll see.
Sure.
Okay, I should continue?
Please.
Okay, sure. So we've had to spend, last count, we were spending $500,000 and maybe even more on some of these devices that we had mentioned before, the webcams in very, very precious and short supply. We also had another huge project in bringing Wi-Fi. We have 2 hospitals and the 17 major outpatient clinics, and the other hospital, a second hospital, and many of the remote clinic sites don't have Wi-Fi. And under telehealth and under this pandemic situation, that became urgent. That's my dominant high priority project that we promised the hospital, is to bring Wi-Fi in by the end of July. And the cost is significant.
Chandra?
Okay, yes, thanks, Yvonne. But from what we have heard and spoken with many of our customers and prospects, so initially the organizations would have incurred the cost towards laptops to enable people work from home, servers and storage for hosting VDI, whichever organizations have adopted VDI as a medium. But in some cases, it could also include increasing the capacity of firewall, because suddenly everyone, about 90 to 95% of the employees start working from home, coming through firewall, then VPN concentrator and network bandwidth. These are the initial investments, but in the long run, all these investments would pay off through increased productivity and, of course, the good work-life balance.
Great, thanks, guys.
Yes, Judge, over to you.
What percentage of your workforce was already working remotely 100% of the time before the COVID outbreak, Yvonne?
Well, if I can jump into that, we had very few. We're a hospital, so we're largely on site. The patients have always been on site. So I would say that that number was 1%, very small fraction of the prior to, say, March of this year.
Okay. And do you believe the large increase to the number of people working remotely has added risk to your business?
Of course, we don't have that much control over what's going on at the employee's home site. We always have the fear. I mean, simplistically, that an employee middle will get up for a break and in comes the teenage child, and sees, in our case, patient data splattered all over the screen. Wow, how do we control for that? Here also, in terms of malware, how do we know what kind of patching is going on at home as one vulnerability area? So yes, this has increased security significantly.
Yeah, perfect. And as a follow-up, how do you remediate, or how do you address those types of concerns?
Well, we stress to our employees working from home best practices, beginning with patching. I mean, we'll get into the BDI. One of the things that we love about the BDI boxes is even when they remote in, they cannot easily do things like exfiltrate. The BDI devices themselves, they have no, of course, local disks involved. They're all patched very, 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 very regularly. Can't use USB drives on that. So we've always found BDI as being as a very valuable to the hospital from a risk perspective, as well as many other perspectives.
And more specifically, Chandra, how has zDesk addressed some of those concerns around security?
Okay, George, that's to me?
Yes.
Okay, so I have a few points here, George and Yvonne. Traditionally, the security controls in an organizations were fully network based, which means when the employees sitting in the network and they work, those controls get applied. But what happens in the pandemic situation, most of the employees were working from their home. Now, how do we apply those controls? So every organization had to resort to agent-based security controls in their laptops, mostly through SaaS-based security solutions. So that is one concern and the mitigation that the organization had to follow. The next one is when people work from home, they largely use video conferencing solutions, audio conferencing solution. Now the attacks on these applications and technologies have actually increased. We have heard from our customers that the security attacks or probes have actually increased 7 times, 10 times into their firewall. So we need to actually, the right mitigation the organization had to follow was, they had to harden the security controls in these solutions. One thing, in fact, some even did the geofence to reduce the attacks, that they actually filtered those who are coming from other countries cannot get into their networks. And all anomalies must be investigated with more carefully and detect the compromises at the very early stage. That's the second challenge the organization had to go through. Third one is patching of laptops, and this problem had been there even when employees were working from office. But the number of laptops that are non-compliant for patching were very few, single digit. Now, since everyone started working from home, unless they're connected to the network, they should not get implemented, patches would not get installed. So organization had to move towards SaaS-based patching solution like Intune for on-premises patching, which is typically SCCM or so. Then the last one, corporate assets. So most of the organizations were not able to provide corporate assets, not because they don't have laptops, but because the employees would have reached place which is distant from their office and they could not ship it. So in those cases, they had to ask the employees to use their own laptops with the necessary endpoint security solutions installed on that. Or we have to ask them to come through VDI and then connect to the customer network. So these are the few challenges that the world has seen in the pandemic days, George.
If I can just add to that, George, just a small amount, that here, faced with the very harsh climate especially back in April and May, the federal government actually relaxed a lot of their security controls. We have HIPAA, of course, very important for all medical systems. And some of these packages like Zoom, Skype, regular Skype, not Skype for business, the federal government basically said, use whatever you can, just to get telehealth going, just to deal with the situation where hospitals were being overwhelmed. And now, so we had a situation where hundreds of thousands of clinicians were using software that was allowed to be non-HIPAA compliant for a while. So you can sort of imagine the field day that the cyber criminals were having in this environment.
Yeah, that can create quite a challenge. I can only imagine. So, gentlemen, thank you. That data is invaluable. So let's talk about the options that businesses are facing when it comes to remote connectivity. For instance, many companies are looking at virtual desktop as a service for the very first time. Can you discuss the benefits and value of virtual desktop as a service solution might provide when empowering a remote workforce? Chandra, I don't know if you, based on your experience, I think I'm sure you have some good thoughts on that.
Sure. Thanks, George. I will say this from 2-3 perspectives. One is first the employee perspective or the user perspective who uses the VDI. Firstly, it is very relatively less stressful because he works from the comforts of the home, and he doesn't have to, particularly those who are working in cities like Bangalore and Chennai, they don't need to commute and actually save a lot of time. But as an employee, as a talented professional, suddenly my canvas actually got increased. I don't need to choose the companies or roles that are available only in my location, or if I have to choose another one, I have to relocate. Now, this remote working has enabled me to work from anywhere. That is one benefit that the employees or the users are actually seeing them. From a CIO perspective, we will see a lot in the coming discussion. There is increased savings for him. The security risks are minimized. I won't say eliminated, but it is minimized, even though I talked about few security concerns, but with the effective mitigations of that, CIO sees as a better solution, lesser secure. Agility gets improved. The provisioning or deprovisioning, upgrading, enabling a workforce, all becomes very quick and easy. End user productivity is actually increasing. Again, we'll talk about that in the coming discussion. How many CIOs and even many users have been thinking that the VDI technology would actually provide a lesser response or inferior responses, because of which the productivity would go down. But actually, that is not the case. Now, when everyone is forced to use VDI, all of them are realizing that VDI is actually as fast or equal to the desktop performance they were getting, and it is actually enabling them to provide more productivity.
Great, thanks, Chandra. How about yourself? Any additional benefits that a virtual desktop has provided to BronxCare?
Yes, absolutely. So we actually embarked on VDI over a year ago here, and there were 6 specific benefits in mind on why we did it. You know, Chandra has already mentioned the security, so I'll leave that alone. But we had an environment where we had a lot of non-standardization, old PCs, old operating systems. We had a lot of XP still, and today we still have a lot of Windows 7. You know, so what to do, how to deal with that? Of course, the answer is VDI enables standardization. Also, from the support staff, those VDI boxes are so much more reliable than PCs, especially older PCs. So our clinicians are very happy that the breakdown rate is much less. So we could actually save on support staff, and the fact that we had less downtime for our clinicians made them happy. Just to underscore Chandra's point, the actual performance of our electronic medical record system, the EMR system, which is the dominant application now for doctors and nurses, went up 10 to 20%. So it actually improved. And finally, it was cost effective. So we saved money. So these 6 benefits have been amplified in the current corona pandemic.
Perfect, gentlemen. Thank you very much. Now I have another poll question for the audience. Which of the following desktop as a service options are you adopting in your organization today? On-premise using a Citrix or VMware, on-premise using open source tools, Amazon Workspaces, Azure's Windows Virtual Desktop, or none of the above? And we'll give the audience a couple of seconds to answer those. Okay, great. In the interest of time, as the audience is finishing up their survey, there we go. Let me continue to ask a few more questions of the panel. Can you both provide some examples of facets of the business that might depend on leveraging virtual desktop infrastructure? Yvonne?
Okay, sorry, should change that perspective and put it on mute. So I'm very sorry. Can you repeat the question, please?
Certainly. What I was asking is, can you provide some examples of facets of the business that might depend on, and I know you mentioned a few of these earlier, Yvonne, and any other parts of the hospital that are very much dependent on using virtual desktop infrastructure?
Well, our entire clinical environment now, which represents about half of our desktops, PCs, we do about 3,500 here now, are largely on VDI now. That's important. It's single sign-on here. We don't have to worry about any generic logins. How do we get this off? Excuse me. The phone here. Unplug this. Huh? Okay, sorry about that. The phone's ringing. Our doctors are always feisty. So in our clinical environments, VDI has become the standard, and those 6 obvious values that I had identified a few minutes ago apply. So they will not want to go back.
Great. Chandra, what are some of the 2 characteristics of a successful desktop as a service deployment?
Okay. So the first and foremost that comes to my mind, George, Yuan, and others, desktop as a service using VDI technology should provide as same as or better response than what the user has been getting when using local desktop or laptop. Just because he is using a VDI or the desktop that is hosted in the cloud, he should not be asked to compromise on his performance. Generally, the performance of the VDI may be affected due to network bandwidth or additional security controls. So first and foremost, the performance should be equal or better. The second one, it should not be creating any discomforts to the user because of tightened security controls. Generally, since we are allowing users to work from home, the security teams bring in more controls, but that should not be providing any hurdles to the user. Then the third one, again, which is very typical of VDI, the mobility. Mobility should not be compromised at any cost. Like the user should be able to access whatever files or applications he or she wants to access from wherever he or she is using, whatever device that he or she has. So these 3 are very critical: performance, ease of use, and mobility.
Great, thank you. Guys, assuming remote working is the new normal and VDI is the right vehicle to deliver on the requirement, VDI is absolutely not a new concept. It's been around for a significant period of time. and there's been a multitude of challenges that I know that organizations that venture down that path have experienced. Can you talk a little bit about what's improved when it comes to virtual desktop infrastructure and what options are now available to the public? Chandra, I don't know if you could take that.
Yes, George, I love this question because I have been associating myself with the VDI for the past 10 years. I know how this has evolved. 10 years ago when VDI was introduced, I can say that the network bandwidth was a challenge. On top of that, the user were thinking that when desktop, when they work on the desktop that is nearer to them would give better performance than a virtual desktop which is kept miles away. But today, we can buy good amount of bandwidth for lesser cost. Because the cost is cheaper, we can go for redundancy and remove the apprehensions about the availability of VDI. That is one big challenge, big change we are seeing. Again, earlier, 10 years ago, we were having lots of thick client applications. So we required application virtualization as part of VDI. But today, the world has moved towards web-based application, and hence the need for app virtualization, app V is reduced or eliminated. I know there are some who will contest this point, but this is real. And next one is the users were reluctant to adopt the VDI because their powerful big desktop was replaced by a small thin client. In those days, thin client was the option. Now we can actually delight them with a diskless laptop that is cheaper than a thin client and more secure than a thin client, or as secure as the thin client. So that's another change that I am seeing. Even though some solutions are some devices, some end user devices like Chromebook may not work with some solution, but definitely there are Windows-based diskless laptops available which can work seamlessly with this VDI solution. Then the fourth major change, of course, all of us know, the cost of storage and particularly the solid state drives are becoming cheaper and cheaper. So in earlier days, we were actually restricting the storage to 5 GB or 10 GB, but today we can actually provide hundreds of GBs. And since we provide them through solid state drives, the response to the user has been very good. So this network bandwidth and the availability of solid state drive actually enabled the VDI to provide better response to the user, and I'm sure that will actually increase the adoption of VDI in the coming days. George.
Chandra, thank you. So quite a bit has changed pretty dramatically, and as you say, adoption is critical. Based on that, continuing down this topic, I know GAVS is offering a desktop as a service. What are some of the compelling reasons one should take a look at zDesk, Chandra?
Sure, I will. Anand, do I have the deck coming or? Okay. Thank you, Anand. So, George, yes, GAVS is offering desktop as a service using VDI technology, and that's called zDesk. What is very interesting and differentiating zDesk from the rest of the solution is that everything that is required to be part of a VDI solution is coming in single stack. You can see from the diagram here that it has a hypervisor, which is the basic one. Then it has a profile manager, and it has a broker, which allows the user to access. Then actually a message bus, which actually helps in finding out in real time what's happening. And most importantly, the storage acceleration, deduplication, that is part of the same stack. And you can also have shared storage, and automatic cluster management is another important. We don't need to create additional layer outside this main stack to provide the cluster management. Multi-tenancy is built in, and of course orchestration as part of that. So all these are in single stack. You can actually install these in a single server, and you get all the benefits that are normally associated that comes with the storage acceleration, cluster management, and multi-tenancy. Typically, this is quite different from what we have been having a few years ago. even compared to some of the other solutions where your broker is separate, profile manager is separate, storage has to be kept outside. So the whole management infrastructure to manage VDI infrastructure was actually draining the whole architecture, makes it complex and increases the cost. It actually accessed from a simple web UI. Some of the key things to make note of, I talked about that in the previous slide, that management is carried out cluster, no additional layer, and it's a real-time telemetry available. So we can actually get quite a lot of information from that. For example, one user, how many times he has actually accessed the application, or how many users have accessed the application for a given time, what's the response time the user has got while accessing the application. Then when coming to storage, it's 100% solid state drives, and that actually provides fastest response. And the RAM is actually used as a storage when the user using. So we have persistent and of course non-persistent. So these are some of the features which actually makes the installation very simple, management very simple, provisioning very simple, and whole maintenance after implementation is actually made very simple. Now what the benefits that it brings, even though VDI by itself can provide some benefits like reducing the incidents, reducing the support cost, reducing the power cost, the zDesk, because of the way it has been constructed, it actually provides more benefits than what a typical VDI solution provides. First of all, Ivan can actually vouch that desk side incidents actually greatly reduced, because there is nothing at the desk side when you are using a VDI, because you will have a thin client, everything happens at the data center. And the mean time to repair, because the incidents are reduced, because most of the calls can be resolved from a central service desk, 80% improvement in the mean time to repair, and the productivity of the employee is improved because the number of incidents that he had to go through or waiting for the help desk engineer is actually reduced. And the next one, the CISOs would love to have this. There is 0% data loss because everything is stored in the data center. The end devices will not have any USB or any disk enabled so that they can actually copy the data and take it. Even the copy paste is disabled. Because the compute, the storage and the applications are hosted next to each other, connected with 10 gig or 100 gig pipe, the response is actually much faster than what is normally getting it. So this is actually key difference. I have a slide and Ivan also can tell some of the application which we thought or which we were thinking earlier that VDI is not good for imaging applications in hospitals, or which is video intensive application. But after we have implemented, we have seen the results. It has been spectacular. Deployment has been faster, and even you can actually access it from your mobile or tablets. You can use any browser, any operating system. Support cost gets reduced because the number of incidents are reduced. So overall, for the CIOs and CFOs, it provides total TCO, there is a savings of about 15 to 20%. And imagine with all the improved security, improved mobility and standardization, cost savings is also happening. Okay. So Ivan has been talking about this. This has been running in Bronx Hospital, used by the clinicians, physicians and various hospital staff. And this is what I was talking about, that you look at the response time that we have got before zDesk and after zDesk, and there is a significant increase in the first time login and the subsequent login. The third one, imaging application dental, we did this when they were using desktops. One image used to take about 4 to 6 minutes to download into the local desktop, local workstation. The reason is the entire data has to travel through the pipe. Now what happens with VDI, the application and the compute are kept next to each other. So he is able to see the image within 30 to 40 seconds. Similarly, we have actually found a good amount of improvement in accessing Microsoft applications. And one of the point I said initially that the bandwidth consumption should be as less, even though the bandwidth is available plenty today for a given cost, but the application should not consume more. So this is what we have seen. When it is idle, it consumes anywhere between 5 to 15, and for normal use, which is the data and little or no video, it's about 50 to 120 kbps, and heavy use that typically involves video that takes about 400 to 700 kbps. That's the response speed it goes. In fact, we have done much more tests on that. File transfer, how to opening of a big Excel file, opening of a PPT, everywhere we have seen significant improvement in the response. And the management becomes very easy. You can have a total overview, and then you can have templates and how many templates are being used, and how many profiles are created, how the profiles being used, and how many pools are created, and what's the utilization of each pool. So management is very easy here. And we have also hosted this at one of our cloud, and you can also actually connect and experience how this zDesk is, that you can actually register and get an ID created for you. Then we have hosted few applications there. You can actually browse the internet. Even you can go to YouTube and see how it performs when you are streaming the video, and you can experience yourself how this zDesk is. George, over to you.
Great, Chandra, thank you very much. I appreciate all the background on zDesk. I'm sure the audience appreciated it also. Pavan, Chandra, based on the wealth of experience that you both have, are there some additional lessons learned that you can share with everyone before we jump to the questions?
Yes. So key lessons learned, like in the future, as we're preparing for perhaps a second surge, is to have a lot of advanced planning. Next time, I'm going to have a lot more webcams available, as well as mobile devices. I didn't mention, but we have to get a lot of these iPads with us for many different applications here. And I think just to underscore Chandra, the fact that we're able to get simpler iPads, diskless remote devices, has been a big benefit. Lower cost and frankly high reliability. So those are it. And just to underscore Chandra's points, a lot of impressive statistics. Our 800 doctors would just say one phrase, that say, "It's faster." So that's something that we do. And I should add that looking forward, of course, preparation. Many of us in the healthcare business were frankly unprepared, hence a lot of the panic that was going on. And to mention one point, George, that you had raised about making this more readily available to the public, we're taking that literally at BronxCare, because one thing that's happening, just take a quick minute here, New York City is requiring that we open up public testing centers so that every one of our 8 million residents in New York can get tested if they want to. So of course, our facilities can handle that, but we're opening tents. So we're working on getting our 4th tent set up and going. And one of the tents provided us interesting remote challenges. A tent that's kind of like far removed in a parking lot, 100 feet away from any device across a public street. And so we were able to use this technology, the standardization that comes with zDesk and VDI, and set that up very quickly, very creatively, and make it work efficiently. So we're very pleased with that. Thank you, George.
Thanks, Ivan. Chandra, anything else that you wanted to add?
Yes. Yes. So in the process of implementing George, we have actually learned few lessons. First, the business applications actually requires more compute power to run than what we actually size it. So the one lesson that we learned is we need to have a reserve capacity always to cater to these users who actually access the business application. Now, what happens is we have a persistent and non-persistent. Even though by design we want to make every user to adopt non-persistent, sometimes we are forced to have some persistent users, typically the developers or those who are actually using heavy applications. Now what happens in there, some users actually use the bandwidth, the resources provided to them, but some users do not use the entire resources allocated to them, because of which those resources are getting wasted there. On the other hand, there are some users who actually need more. So we have felt the need that there should be an automation need to built in where it constantly looks for the utilization of the resources in the persistent desktops and then add or release depending upon the consumption. So this is where we want to bring our AI into that, and since we have been developing a lot of AI-based infrastructure solution, with our AI, we can actually predict when a user would need more bandwidth or what kind of bandwidth, and accordingly, before he gets impacted, we can actually add more resources or remove resources and make the virtual desktop always run at optimized level, so that the whole infrastructure is running at optimized one. That's what we are currently working on, George.
Great, thank you, Chandra. Thank you both. Great insights. And Yvonne, I can't thank you and the team and everybody there at BronxCare for all of the support you've given to the community. I know it's well appreciated. Guys, with 10 minutes to go, I've got a number of questions from the audience that I would like to read to you, and please jump in and if you could address them. Number one, some applications require shared drives. How have you accomplished this with the shift to WFH, and any examples?
We have not had any problems in users accessing shared drives. We've had departmental drives set up before, and this is just an extension of that. So that, again, zDesk and VDI makes everything a lot simpler, including sharing of files on shared drives.
Okay, great. Does forcing users to use VDI negate some of the patching issues that might be going on with a user's home or personal device?
Yes, I mean, as I stated, one of the big advantages that we went to under security, one of 6 major advantages of VDI was the fact that we didn't have to worry about patching. Now, our users coming from home, they still have to worry a little bit about their home patching, but then, you know, the fact that it comes in through HTML now, right? It enables that to go a lot simpler, a lot easier. And frankly, the fact that there's no USB ports, you know, associated with VDI, that's a blessing also.
Great, thanks, Ron. Question 3, what factors were considered when comparing zDesk to other remote VDI solutions? And what did you find as the main decision factor for zDesk?
Is that to me or to Chandra?
I think that would be to you.
Sure. Okay. No problems. Well, a very dominant issue because of the nature of our business as a patient safety in the hospital was cost. So that there are a number of solutions out in the market, and we did take a look at many of them, and we found that the one that we settled on, the one that with our partners GAVS, was this HiveIO system that provided us with rock solid VDI and zDesk at a very, very cost-effective manner.
Great, thank you. Question 4, how do you decide between providing then client devices versus bring your own devices when doing desktop as a service? What are the options there? I don't know, Chandra, if you've got any thoughts on that.
George, I'm finding it difficult to hear you. Is there a way to type the question in the text, chat window?
The questions are in the moderated part of the chat window. So if you scroll down, do you have access to that?
When Chandra is looking, I can jump in and give the users here. I mean, thin client devices are dominant. We hate fat clients, because more and more of our people, they're using these diskless iPads and tablets and the like. So the thin client we've embraced everywhere.
Perfect. Chandra, I don't know if you can hear me.
George.
Yes, go ahead.
Yes, now I got the question. Thanks to Anand. So today, with the advancements in the security and the flexibility that the organizations want to provide to the employees, there is actually no debate whether to force a thin client or allow the employee to use BYOD. Actually, I talked about that in my responses. Even when the organizations is not able to provide the corporate laptop, you can actually let the employee to use their personal device by making him coming through VDI. So today, I don't think we need to worry about that. If someone is ready to adopt a BYOD, we should go ahead with that, Josh.
Great, thank you, Chandra. Couple more questions. Does zDesk have any ransomware / encrypting detection to prevent malware spread from an endpoint to other locations on the network?
It's probably to you, Chandra.
Okay, so the zDesk as such does not have any security prevention tool, but the periphery through which the users can access the zDesk needs to be protected with such protections. For example, we don't allow the users to directly enter into the zDesk server. We actually provide a gateway server with a hardened image, and that makes sure that ransomware or any such malwares getting into the device. That is one. Second one, we also protect that using geofence. I was talking about that. Geofence make sure that only people from certain locations or countries get into the system. So we protect the periphery more than providing that inside the zDesk software.
Great, thanks, Chandra. One final question. Can zDesk be used for employee onboarding? Or what's its role in employee onboarding?
I'm not very sure about the question. If the question is whether we can give zDesk on day one to an employee who has joined, yes, of course we can. And in fact, that is what many organizations are doing, including the clients that we have. Because that is the advantage of zDesk and of course the VDI, that it comes with agility and you can onboard an employee with zDesk.
Great. I think that wraps up the rest of the questions. Gentlemen, I want to thank you both for taking the time to share all of this wealth of information with the audience. Look, this is with everything that's going on in the world right now, this type of data is invaluable. I'm sure most of the audience is going through these types of decision-making as we speak. So again, I want to thank you both for the time that you spent, for the information that you provided. I'm sure that that the audience found it extremely beneficial. So with that, thank you everybody for joining us today. I hope you enjoyed the webinar.
Thank you, George.
Thanks, guys.
Thanks, Ivan. Thanks, George.